You're listening to Finding Fortitude, a podcast that aims to help former athletes take good care of their minds and bodies through sustainable, evidence-based health habits. I'm your host, Dr. Tori Williams, a physical therapist, coach, and fellow former athlete who is ready to be part of the change in healthcare and who is on a mission to learn and share about all things health and well-being so that you can be equipped with the knowledge and tools to live your best life. As a reminder, nothing shared on this podcast should be considered medical advice. Let's get started. All right, hello there, and welcome back to another episode of Finding Fortitude. I am so glad you're here today because today's episode is going to be a very important and informative one. This is definitely a topic that is not talked about enough, and I think it's going to be an episode that lots of people refer back to, including myself. My guest today is a doctor of physical therapy who specializes in pelvic health and helping individuals who are suffering with bowel, bladder, and sexual health issues, including individuals who are pregnant or postpartum. She is the owner of Ponderosa Physical Therapy, an outpatient orthopedic and pelvic health clinic where I work part-time. So yes, that makes her my boss. But she's also someone who I consider a mentor and a friend, and I'm super excited for you to hear from her today. So welcome to the podcast, Dr. Chelsea Lynch.
Thank you for having me.
Excited to have you here. Do you mind giving the listeners a little background intro about who you are and including your background or experience with athletics?
Absolutely. I am the owner of Ponderosa Physical Therapy, which I co-own with my husband, Peter. He's also a physical therapist. We met at Northern Arizona University, which is where Tori went as well. So we also have that in common. Go Lumberjacks.
That's right.
I was interested in pelvic health as a college student because it was affecting everybody's lives so much and nobody wanted to talk about it. I had gynecology appointments and they were fine, but I had so many questions and I didn't feel like I could really talk to the doctors. And really, it was about sex. I was very curious about sex that we're all doing, but there's nobody's really talking about it. So I thought, okay, I'm going to be a gynecologist because I want to spend time with women. I want them to be as healthy as they can be. I want to talk about sex and babies and how to just feel good in our bodies. So I researched this a little and found out that to be a gynecologist, a lot of your job is prescribing medications and doing surgeries and maybe delivering babies in the middle of the night. None of those sounded appealing to me at all. So I kept doing some research and discovered pelvic physical therapy. And it had the one-on-one time with women, the advocating for health, the advocating for activity and exercise, but with a schedule that could fit with the kind of personal life I wanted to have. I knew I wanted to have my own kids and maybe have a business someday. So pelvic physical therapy just fit better. And I was able to do internships early and get exposed to pelvic physical therapy, and I was sold. It's like, this is it. This is, if I had created my own field just to suit me, this is what it would be. So I've been a pelvic physical therapist now since 2011. My sports background, I've always been very active. As a kid, I played soccer. I played 1 year of softball in high school just on a whim, and I got most improved. I was very proud of that on my JV2 team. I think I was like a junior. It was awesome. I loved it. It was so much fun. In college, I did a year of crew and played a lot of rec sports, and I've gotten more into sports as an adult. So after I had my children, there was childcare at the gym and tennis. It's like, this is convenient. So my um, kids were all taken care of, and I started taking clinics, and I've been playing ever since. I also like to do Pilates, and my latest hobby is running. Now that my kids are older, I've got a little bit more free time. So I did my first half marathon back in March, and I've got another one in October.
Crushing it. Yeah,
Yeah.
awesome. I love that. Also, for the listeners, Chelsea is also very good at pickleball, even though anyone who plays tennis, and I don't know, maybe you feel this way too, Chelsea, but I feel like I talk to a lot of people that play tennis that really poo-poo on pickleball, and they just find it as like the most insulting sport. But it's like wildly popular now.
Pickleball is so popular, and tennis players are especially bitter because the tennis courts are being transformed into pickleball courts. So we've got a beef with this, but secretly we know pickleball is super fun, and it's only a matter of time before we're all going to switch over to pickleball. Don't tell anybody I said that, but that's probably the truth.
You heard it here first, everybody. Okay. Well, we are going to dive into the topic for today, which is pelvic health as it relates to pregnancy and postpartum. I think this is a topic that generally people don't know a lot about, for reasons maybe like what you were saying before, like we just haven't talked about it enough. It's not openly talked about, although I see now it's being talked about much more. Um, can you touch on why it's important to even consider our pelvic health when getting pregnant, or maybe what some of the most common issues or things to look out for would be?
Yes. So having a kid is so cool and amazing. And our bodies do the craziest things. And sometimes those changes are not very comfortable. Maybe they're painful. Maybe you're noticing leaking issues. Maybe sex is not feeling good. What a pelvic physical therapist can do is help you address whatever those issues are that crop up. And every pregnancy is so different from person to person, but within that person, just week to week. So having a physical therapist that you can come and say, today my hip is killing me. And then we're going to work on your hip. And then the next time you're going to come in and you're going to say, I am so constipated. Like, what do I do? Uh, to have a pelvic specialist work with you as these things change just makes you a lot more comfortable. And if we can come up with a really good plan, like homework for you to do so that the birth experience is as smooth as possible, then you can focus on just making that baby and getting it into the world safely.
Yeah, that makes a lot of sense. And I think maybe for a lot of women, getting pregnant or trying to get pregnant may be the first time that they really consider what's going on down there.
Mm-hmm.
Can you talk a little bit about like how much of pelvic health physical therapy is like, because I think most people think of physical therapy, they think of exercise. Is that a lot of what happens in pelvic health physical therapy, or is it also like education and just kind of guiding someone through the process of pregnancy?
Mm-hmm. Uh, the first step is to figure out, what is this patient's experience? What's feeling good? What's not feeling so good? And then we can figure out exactly what strategies are going to help that person. So maybe it's going to be exercise, maybe it's going to be manual therapy, like things with our hands. But the biggest, most important thing that we do is patient education. Like I mentioned constipation. So as your baby gets bigger, there's more pressure on your bowels. People can get pretty darn constipated. So talking about things that you can be eating and drinking, toileting strategies, abdominal massage to help facilitate digestion. That's going to be the biggest piece is the education component that you go home and you can experiment with because there's only so much, magic I can do with my hands while you're there in the session with me.
Mhm. Yeah. And of course, like you said earlier, everything's always like constantly evolving too, right?
Yes.
So it's not like, okay, for the next 9 months, you're going to do this one thing, right?
Hmm.
Or is there anything that you do usually give someone like, okay, throughout your pregnancy, these are a few things that are a good idea to try? Or is it really based on the individual?
The birth plan is something that's going to be pretty consistent. So what that means is I want this pregnant lady to be really confident that she can relax her pelvic floor muscles. So during birth, you got to relax your pelvic floor muscles to let that baby come out. So I'm not giving everybody a whole bunch of Kegels because that's the opposite. Kegels are contracting your pelvic floor muscles and keeping things in. So for every patient, I want to make sure that they've really got that down, that control. And then beyond that, I have a special list of postpartum things, your little postpartum kit. Uh, and these are kind of tricks of the trade that I've gathered together professionally, but also personally with my own children, having my own kids. And so this little cheat sheet has things like, all right, you need to have an ice pack that you can put on your vulva. You need to think about stool consistency. So let's get the stool softeners going. And there's some things like that that are pretty consistent person to person.
Okay, cool. Yeah, that makes sense. So there's certain like tips or things that you can give to people, but beyond that, like there's going to be a lot of individualness,
Yeah,
obviously. Yeah.
so much variation because it's shocking how everyone's experience is so different. I have pregnant ladies that say, I've never felt better. I feel so good. I wish I could be pregnant all the time. All I want from you, Chelsea, is to learn about, what to have in my postpartum kit. And then I have someone else that says, I am so miserable. My back is killing me. Let's just try to figure out how I can make it through these next couple of months. So, and anything in between.
Yeah. So, and along those lines, I'm thinking of, my audience and how there's a lot of former athletes who want to continue to be active while they're pregnant. And I think for a very long time, there was a lot of fear around exercise and movement while you're pregnant and not wanting to hurt the baby, et cetera, et cetera. Can
Mhm.
you speak a little bit to that in terms of like, and I know it's going to vary based on the person, but like what is safe?
Yeah. So much is safe. If you were doing it before, you can do it. If it feels good, you can do it. You can get your heart rate up. You can run. You can jump. You can lift. All of these things are going to be good for your body. They're going to be good for the baby. They're going to be good for your mental health. Giving birth is such a marathon. It is so physically demanding. If you're going into that process healthy and strong, it's just going to go better. That being said, pregnancy is not the time to pick up something new. If you are not a CrossFitter, don't try to become one when you're pregnant. It's just not worth it. So if you were doing it before, you can still do it. A fear that people have is laying flat on your back. Like if you're a Pilates person and you want to lay on your back, you can do that. If you feel good, if you can breathe comfortably, go for it. Your body will tell you if laying down, if you're not getting enough oxygen, you feel really weird and crummy immediately, and you just get out of that position and it's just fine. So I want to calm people down when they come and like, I woke up and I was on my back and they're panicked. Like, you're fine. Your body's really smart and it's okay.
Yeah, that's a good one because I've heard that too. Are there any other like common myths or misconceptions about pregnancy that you hear often?
Well, they say don't lay on your back. They also say don't lay on your stomach. That's another one. If you're feeling fine, so if you're especially in the first and second trimester, if you're fine if you feel good, you can be on your stomach sleeping or exercising. That's totally fine. Getting your heart rate up is something that people are fearful about. That's fine. If you're feeling good, go for it. Getting too hot is another thing people are fearful of. Um, there's some truth to that, but if your hot bath feels good, great. You know, doing a lot of saunas, like that's taking it too far, but you can have a hot bath. You can get your heart rate up. I want you getting sweaty. All that's fine.
That's great. So the messages I'm hearing, and please correct me if I'm wrong, is there's a lot of nuance and like things in moderation are a-okay.
Hmm.
Number two, kind of listening to your body, and your body's going to tell you.
Hmm.
And potentially maybe baby will tell you if they're not liking it either.
Hmm.
And don't be afraid to continue exercising. And there's really no bad or unsafe inherently things to do as long as you're prepared for them physically. And maybe you have a history of doing those prior to.
Yes. If you have the skill and that fitness level, go to town. The big scary thing is falling.
Hmm.
So if it is, I don't know, horseback riding or downhill skiing, I don't know, even that one. If you're like a pro downhill skier, you know your skill set, but falling is that's the scary thought.
Okay. Yeah,
Mhm.
that makes sense for pretty obvious reasons.
Did
Um,
you hear about some of the Olympian pregnant athletes?
yes, yes. Tell me more though, because I know that there was a shooter or an archer.
Uh-huh. There was I think, a judo athlete who was like 7 months pregnant.
Amazing.
It's amazing. Like there's so much that our bodies can do. And if you're feeling good, it's good for everybody.
Yeah. And this is probably also a little bit of like a nudge or a plug to say, hey, if you want to have an easier time during pregnancy and potentially childbirth, being fit beforehand is probably a good idea. So trying to get into a routine beforehand that you would like to continue is probably a good thing, right?
Yeah. You're training for giving birth. It's really hard and long. So you want to have good fitness going into it.
Yeah, I don't feel like that's talked about enough. And I think, among my audience, there's a lot of people that are already like really actively engaged in that. But I think thinking of it very intentionally as something that you're going to have to physically perform in is, I think, really key.
Mhm.
Would you say, and we're going a little bit off on a tangent here, but would you say that endurance would be more important to prepare you or strength, or are they kind of a blend of both that matters?
I think endurance, because it is your uterus that pushes out the baby. And
Hmm.
you can't train your uterus. So you've got to have the endurance to make it through that 12 hours or 24 hours or however long it's going to be. Um, but the actual pushing of the baby out, that's all uterus. And your job is to try to keep your pelvic floor muscles relaxed and open. So, with some of my patients that are higher level athletes, they can get too grippy. They can get pelvic floor tension, and they may have had some misinformation from the internet about Kegels, and they might be going a little overboard. So if that's resonating with you and you're thinking, am I kind of a tight, grippy kind of gal? That you would be an excellent candidate to go to pelvic physical therapy to make sure that you can fully relax your muscles before trying to give birth.
Yeah, that makes a lot of sense. Yeah, you hear a lot, or at least I have heard a lot as, friends are getting pregnant and having babies that like tearing is a
Mhm.
big issue. Is that mostly, I mean, I know there's lots of different reasons that can happen, but are there things that you can do in pelvic health physical therapy to help you reduce your risk for tearing?
Maybe.
Okay.
There's not evidence to support that. I don't think good studies have been done about that, but it's worth a try. So the thought process is, okay, number one, I want this patient to be able to relax their muscles and breathe. Number two, I'm going to teach them to mobilize their perineum kind of stretch it a little and get used to keeping their muscles relaxed while there's something happening down there, while there's some stretch happening down there. So this self-mobilization is a technique that I have everybody start doing in their third trimester, all the way up to giving birth. And perhaps that will help with tearing. Sometimes you just have a really big old baby. And if it's your first baby, tears are pretty likely. It's just, I don't know, part of the process. So I never want to like draw a straight line from, oh, you tore, it means that you did something wrong and things are too tight. Like there's a good chance that's just going to happen anyway. And we're doing what we can to keep it to a minimum. But when tears do happen, um, that's another reason why people will come back to pelvic physical therapy and they rehab really well. Like we can make sure that that scar tissue is pliable and just like any scar. If they had a knee surgery scar, we can work on that tissue and make sure that it's as healthy as it can be.
Yeah. Okay. So I'm hearing lots and lots of different reasons why having a pelvic health physical therapist in your corner as you're going through this journey is a really good idea.
Mhm.
Um, Anything else that you can think of before we move on to the postpartum period that you think people should know about pregnancy?
I especially love treating pregnant patients because every week is so different and it just reminds me how cool bodies are. So you want to find a pelvic physical therapist who really is a specialist. Sometimes folks will say that they're a pregnancy specialist and they're not even a physical therapist. You got to vet them. So you know that you have a good pelvic physical therapist if they've had specialized training and that they do internal exams. So they do pelvic exams. You learn so much about your body when you have a pelvic exam. So if that's not in that clinician's wheelhouse, you're not going to get the best care.
Hmm. That's a good point. Okay. And then one other thought I had about that is there an increased risk for certain types of injuries, ligament injuries, tendon injuries, when being physically active while pregnant?
There is, and that's because you have more relaxin hormone. Well, there's a few different reasons. So, relaxin is a hormone that makes everything a little more loosey-goosey. So, that's one factor. Another factor is you have a lot more weight in your abdomen, and it puts different pressures in your joints. And then a third issue can be your balance is off. Your center of mass is different. So these are the factors that we're dealing with. The people who tend to get hurt are the ones that are not listening to their bodies. So if you're feeling pain and you're pushing through it, or you're having a hard time slowing down, if you're keeping the same, pace for your running, or you want to lift the same amount of weight for your deadlift, that's when the risk of injury goes up. You're going to have to adapt and things are going to have to change as your body's changing.
Yeah, good point. Thank you for saying that. I think that's going to hit home with people because as athletes, sometimes we have a hard time slowing down and we think if I could do it then, why can't I do it now? And I think this is very much one of those times where it is 100% appropriate and necessary to slow down a little bit. Not
Mhm.
again, not saying you can't exercise, but just changing your expectations for what that should look like.
Mhm. And making sure it feels good.
Yeah. Okay, so we're going to move into postpartum now. So this is after having or giving birth. What do you think are the most common things that you see as a pelvic health physical therapist after pregnancy is over?
Mhm. There are three big things. So, thing number one, especially for the athletes, are returning to activity as quickly as possible. Thing number two that I tend to see a lot is pain with intercourse and having a lot of fear and difficulty with that. And then a third common theme that I see is having some difficulty with changes in your physical appearance. That's another really tricky one.
Mm.
So when a patient comes to see me, first I'm going to think about and ask them about what their birth experience was. So there are vaginal deliveries that are pretty darn smooth. There's also, on the other end of the spectrum, very traumatic vaginal deliveries, both emotionally and physically. And then there's cesareans. So that's a whole nother bunch of considerations there. So we're going to address whatever tissues were damaged or whatever happened to their bodies. And then we're going to transition into those three big themes, like the exercise, the sex, and the body changes.
Yeah, those are big. So I keep seeing this post that like floats around every once in a while on Instagram that talks about how for every major surgery, and I'll say almost every major surgery, we're recommending physical therapy to help you restore your normal function of your muscles and the way that you move, etc., except for childbirth. Are you seeing that it's more common now to have doctors refer to physical therapy, or is this still very much something that each person is going to have to advocate for after giving birth?
There's been some big changes with referring new moms to pelvic physical therapy, and I'm so excited to see this. So when I was a new pelvic floor physical therapist, nobody had ever even heard about this. It was the providers in our town were a bunch of old men. And they were like, sure, pelvic PT, fine, but it wasn't really even on their radar. So fast forward now, 15 years later, things are changing. It's so exciting. And I think there's a few reasons for this. In some countries in Europe, every person that has had a baby gets a referral to pelvic floor PT. That's just part of their normal care. And I love that. I want that for everyone. So
Yeah.
that's helped a lot. But also, celebrities have been talking about pelvic physical therapy. And if, Rihanna, I don't know if I said Rihanna, but I made that name up. But if people like Rihanna are talking about it, this is great. It's like it's on the internet now.
Mhm.
Someday, I hope every postpartum person comes to pelvic PT.
Yeah, I hope so too. Yeah, it's definitely something that I advocate for among my friends, and something I'm starting to see more commonly, but it still seems like something you have to ask for, at least for the people that I've talked to. It's not something that they're just automatically being sent.
Mhm.
Maybe in the case of like a really traumatic, um, birth, but otherwise, if it's kind of your quote unquote typical, which I don't know what that even means,
Mhm.
birth, then it doesn't seem like they're just given that 6 week check-in with their
Yeah.
doctor and going, okay, you're cleared to go back to whatever your normal life was, which is problematic. I'm sure you could talk to that a little bit too.
Mhm. And for athletes, you guys have big goals. You want to be in the race. You want to be lifting this amount of pounds. We got to strategize for that. I think my perception is that docs are like, oh, yeah, you're fine. Just go on some walks. But that is not going to cut it for a high level athlete. So you need more than just go on some walks.
Yeah, you need a plan, right? And that plan's going to be different than like just a regular fitness plan that you were doing before you got pregnant. It's going to look
Mhm.
different now. Can you talk a little bit about like what that general on-ramp period is like? Like, are there any certain things that you're watching for the first several months to a year? Like, what can people expect?
So and this is going to kill people, but a realistic timeline is a year. There is so much on the internet about bouncing back after baby and getting your body back after baby. And I don't know how, like the women in those images, it's got to be photoshopped. Well, who knows? But everybody's different. A year is a realistic time frame. Your particular birth experience is gonna maybe speed things up. Maybe everything went really smooth. If some stuff went down, it's going to take a little bit longer. There's just a lot of variation that can happen there. And it's critical to slowly build back up to where you were. Just with like any injury, if you're an athlete, you can't just hop right back in where you left off. So slowly building up little bit by little bit over a realistic time frame, like a year. In the very early stages, I want people to pay attention to their bleeding. So it's tempting to get out there and get your heart pumping, but then if you're noticing that you're bleeding a lot, you are pushing it too hard. Um, I spoke with a midwife once about this, and she said the reason you don't want to see a lot of blood means that what that means is the lining of the uterus is still bleeding. You want the lining of the uterus to heal up as quickly and nicely as possible so that if you have a subsequent pregnancy, if you want to get pregnant again, there's more space for that placenta to attach with less scar tissue. So more scar tissue might mean that that next placenta is going to have a harder time getting a nice healthy seal. So that really resonated with me. So for that first month, this is just one more example of checking in with your body and making sure that things are feeling good and that you're not overdoing it.
Yeah. Okay. And then what about after that first month? Like in the first 6 months, are there any other things that are commonly coming up for people, or is it really individual?
It's well, for the athletes, it's pacing, like slowly building and not doing too much too soon. But the other big thing we tend to see is pelvic girdle pain. So your pubic symphysis can become pretty sensitive. Your sacroiliac joints can become pretty sensitive. And what can exacerbate pelvic pain is some exercise positions like lunges, things that are asymmetrical, can be more aggravating than something like a squat where things are staying symmetrical. So if you're a pelvic girdle pain person and you're an athlete, you definitely want to talk with a physical therapist to figure out, okay, what exercises can we focus on? What do we need to hold off on? And to help this feel better quicker.
Yep. Yeah. And I've definitely seen that. I've seen postpartum moms with ligament issues like ankle sprains, and then a
Mm-hmm.
lot of like SI joint issues and pain there too. And like you said, it's a lot of not saying you can't go out and do exercise. It's just, okay, let's modify this for a little bit until your body's more tolerant to these positions.
Mm-hmm.
And then maybe once your ligaments are not quite so relaxed, which I don't know, maybe you could touch on how long that takes, but that's generally what I've seen.
Mm-hmm. We didn't mention pelvic girdle pain during pregnancy, and that's
Mm.
another biggie too. Um, how long it takes varies a lot. One big factor is breastfeeding. So if you are feeding your baby by lactation and you're exclusively breastfeeding, your hormone journey is just going to stay a little bit wonky for longer. So it's just going to depend. If breastfeeding's not for you and you're going to do formula feeding, you'll get back to something that feels more familiar to you quicker.
Mm.
But there's the how you feed your baby is a really personalized and emotional discussion.
Mhm.
Everybody's just got to do some soul searching on that. But have knowing, okay, if I'm going to breastfeed, there are going to be some hormone implications, helps you understand why your body might feel a certain way, which I think is comforting. It's like, okay, yeah, that makes sense.
Yeah, absolutely. Yeah. And I think the theme that keeps coming up here too is everybody is going to be different. Everyone's journey is going to be a bit different. And while there are like some consistent themes that you can pull out and pick from a lot of this, I think the really key thing is to really try not to compare yourself to maybe your friend who just got pregnant or whoever celebrity on the internet is talking about their recovery, right?
Mm-hmm. And to just cut yourself some slack. because it's hard. And the year timeline is just so much more reasonable.
Yep. Yeah, for sure. One other thing I wanted to circle back to, like in reference to like exercising and kind of pacing yourself in the postpartum period. Well, two things really. The first one is leaking.
Hmm.
Is leaking a really common complaint that you see as a pelvic health physical therapist in the postpartum period with people doing too much too soon?
Well, let's back up a little bit to pregnancy and
Yeah.
leaking because we didn't mention it there. When you are really pregnant and you have a big old baby in there, you're probably going to have some leaking. It's just a physics issue. So even the healthiest pelvic floor in your third trimester, you're probably going to have some leaking. It doesn't really mean anything. It just, except for that you're growing a baby.
Mm.
Postpartum, the first month, you just got to let the dust settle. Who knows what's going on down there? You just got to give it some time. After that 4 week mark, if you are leaking urine, we got to fix that. This myth of, oh, you had a baby. Yeah, you're going to leak when you sneeze. Shouldn't be that way. It's not true. So come see your pelvic PT so that we can figure out exactly why you're leaking and what to do about it so that you can go do running as your hobby or running, playing with your kids or whatever you want to do with no leaking. That's the goal. And it's achievable too. Like it's an achievable goal that we should all be working on.
Yep. And so kind of going back to that question then, like it seems as though if you are pushing yourself physically too much too soon, if your pelvic floor is not quite ready for the activity that you're doing, you may experience some of the leaking symptoms. Is that correct?
Yes, but you'll also need to chat with your physical therapist about what your goals are. So I have certainly had patients that say, I am training for this race and they might be leaking. And I'm not going to tell them to stop training for that race. I'm going to tell them, okay, here's the exercises I want you to do. Here's a good pad that's designed for urine that I want you to wear while you're training. But it's not a sign that you're doing any damage. We'll have to kind of weigh with that person, should you or should you not be doing this activity?
Okay. Yeah. And more of kind of like a management plan rather than like, okay, stop everything you're doing. It's kind of like weighing priorities, it sounds
Yeah.
like.
Uh-huh.
Okay. Even still saying, obviously, that the leakage is not normal and that's not something you should necessarily push through and not consider.
Mm-hmm.
But that just because you go to a pelvic floor physical therapist, if you're nervous about going because you think they're going to tell you to stop,
Mm-hmm.
that's not necessarily always the answer.
Mm-hmm.
Okay.
Yeah. It's not a sign you're doing any damage, but it is something that we want to fix because it's no fun.
Right. Yeah. And then the other thing I wanted to go back to when it comes to like that early postpartum period or that first year really is postpartum depression.
Mm-hmm.
And how that can potentially impact maybe someone's motivation to move or exercise or get back into their normal routine. Do you see that often as a pelvic health therapist? And how is that something that you kind of help people or guide people to the appropriate resources for?
Postpartum depression, or sometimes called baby blues, people will use that term because it's a little less stigmatized, is the real deal. I had postpartum depression with one kid, but not the other. It's really a random kind of thing. It just whatever your brain chemistry or hormones are, it can happen sometimes, but not other times. The word that comes to mind for folks with postpartum depression might be overwhelm.
Mm.
There's so much you have to learn when you're a new mom, especially if it's your first baby. There's relationship dynamics that change. There's identity issues wrapped up in that. And if you're feeling so over the top overwhelmed, exercise might need to be on the back burner for you, maybe. Um, if you have that overwhelm, maybe exercise is your little slice of heaven where you can take care of your own body and not have a little screamy, slimy thing on your body at that moment. I've seen that too. But if a patient of mine is struggling, I want to connect them to therapists. In our community here in Grass Valley, they have excellent home services that are free, where therapists and sometimes nurses will come to your house. And I had that service with my second child. And it was so great because I didn't have to go anywhere. Uh, Highly recommend. So you want to make sure that you're accessing those resources because they're available and they help so much. The evidence for um, therapy helping with postpartum depression is there. So take advantage of it.
Mm-hmm. Yeah, absolutely.
I wanted to talk about diastasis,
Mm-hmm.
aka
Yes.
diastasis, aka belly separation. It is having a moment on the internet. So
Mm-hmm.
I'm seeing a lot of, and this might just be my feed because I'm the pelvic lady, but um, there's lots of people talking about belly separation, and they want to sell you programs that are going to help you tone and lose the pooch. And they want to tell you what you can and cannot do, like this big list of no-nos. Um, I think pretty much every pregnancy, you're going to see some diastasis. So if everybody has this experience, I'm not convinced it's a pathology. I mean, there are people that have a larger separation than others, but having some separation is very normal, and it's not going to affect your life or your function. I think people are trying to sell you stuff. I think that's the biggest driving factor here. So when I have a new mom come and see me, I measure. I want them to also measure themselves to know exactly what we're talking about here. I want to calm down some of their fears and encourage them to do pretty much any abdominal exercise they want to do. There's not a big no list, there's not dangerous moves. What I want them to think about is, can they breathe while they're doing that exercise? And can they think about drawing their belly and their pelvic floor in? So if they can still breathe and activate their muscles while they're doing whatever exercise, they are going to be fine. They can rotate and do Russian twists. They can do crunches. They can do planks. They can do like supine bicycle. That's all fine if they can breathe and they're activating their muscles.
Yep. And you may have said this, but just to be like crystal clear, diastasis, we're talking about like separation, like in your abdominal wall, right?
Mm-hmm.
Okay.
Mm-hmm. And it happens when your belly expands with the baby, and it will narrow once that baby comes out. Is it ever going to go back exactly so that one part of your abs is right next to the other when they're abutting? Probably not, but it's much less of a deal than the internet makes it out to be. And seeing a pelvic therapist to have them actually measure you and have you feel more confident that you can go back to doing those exercises, I think is really helpful. Takes away a lot of the fear factor.
Yep. Yeah, I find that this is definitely an area where there's a lot of fears, like which is reasonable, right? Makes a lot of sense. There's a lot of unknowns. There's a lot of things that, especially if this is your first pregnancy, you just don't know until you get there. And so I think it's really important, and I see that as one of the major roles of a pelvic health physical therapist is really helping walk you down that path and down that journey, and helping kind of dispel some of these myths or common misconceptions or concerns, um, or at least giving you some context for when those things matter and when they don't, and that sort of thing. Along that same line of thinking, is there anything else that commonly comes up in terms of myths, misconceptions, misinformation in the postpartum period?
The sex issue.
Mm.
So at the 6-week mark, your obstetrician will probably say, okay, you're good to go. And that is a good timeline for some people, but not for others. That 6 week benchmark is pretty much made up. There's not really any science behind that. And other factors could be your particular birth experience, your emotional state, how much support do you have, how much sleep are you getting? There's just so many factors. Um, and people feel, I think, a lot of guilt and shame if they're just not rip roaring to go at the 6 week mark.
Mm-hmm.
The hormone factor is big. So your vaginal tissues can feel really stingy and sensitive and dry. And there are definitely things you can do about that, like having a great lubricant. And a pelvic PT will make recommendations about what good products are. But one thing that we're seeing more, which I'm so thrilled about, is using vaginal estrogen in the postpartum, like first year. It helps so much. Usually we think about vaginal estrogen with women who are going through menopause, but some of the tissue changes are very, very similar, and it all has to do with our estrogen levels. So using vaginal estrogen in those early months makes things a lot easier. So if you're someone who's having some of this like stingy burny, it would be a very effective intervention.
That's a good point. Hadn't heard about that in postpartum.
Mhm.
Anything else before we kind of wrap things up?
Just a little comment to folks that might be past the early childbearing years. Perimenopause and menopause are other wild and interesting and beautiful journeys that we go on. And there are musculoskeletal things that can happen in the perimenopause and menopause phases in our lives. So if you, well, there's this new term, it's called the musculoskeletal syndrome of menopause. This just was coined in July, and we're starting to talk about how changes in your hormones affect the musculoskeletal system. So if you think that your joint pain, like, oh man, I turned 45 and my knees and my back are killing me, have a talk with your physical therapist about this. Have a talk with your doctor about this, because there are things that you can do, whether that's physical therapy or some hormone intervention.
Yeah. And it sounds like, at least right now, because this is still very new and this is still a newer topic, sounds like this may need to be kind of like after you give birth and you advocate for yourself and you ask for physical therapy and saying, I want to go see a physical therapist, or
Mhm.
this is something that I want care for, right?
You'll have to have me come back and talk all about perimenopause and
Yeah,
menopause. You know,
absolutely.
as I am, my kids are bigger, my body's changing. Like that's highly pertinent to where I am in my life, and I'm all about it.
Yeah, absolutely. Yes. I feel like we talked about a lot of things today, and there's still so much we didn't get to cover. So we'll absolutely have to have you come back and learn all of the things. So thank you so much for your time, Chelsea. Is there anything else that before we sign off that you want people to know about, something you've been thinking about, or any sort of summary of what we talked about today that you want the listeners to take away?
I want listeners to feel more confident exercising, whether that's as a pregnant person or postpartum. There's way more that you can do than you shouldn't do. And if you're having trouble, come see a pelvic PT and we can help you navigate any issue that you might be having.
Yeah. And along those same lines, if people want to connect with you or come see you, even
Mhm.
if maybe they're not in the local Grass Valley area, how might they be able to find you or get in connection with you?
Mhm. So you can go to our website, which is ponderosapt.com. You can email me, Chelsea, at ponderosapt.com. Uh, Tori knows where I work. She can track me down. Uh, You can
I
check
know where to
out
find you.
you can check out our Instagram page, which is at Ponderosa_PT. We do telehealth. So if you are in the state of California, you could have a session with me. Also, we have three other pelvic physical therapists on staff that would be happy to work with you guys as well.
Not me. I'm in the ortho land still, but all of the pelvic health PTs at Ponderosa are awesome. So would 10 out of 10 recommend. All right. Well, that is it then for today. Thank you so much, Chelsea, for being here. This was really a really super informative episode. And like I said at the beginning, I really think this is something that people are going to come back and listen to, maybe when it's appropriate for their life. So thank you again so much for being here. And that is it for today. If you liked what you heard here on this episode, please leave a rating or review. Show my boss some love. Make me look good, y'all. And share this episode with someone who you think might benefit. And that's it. I'll see you again next time. Have a lovely day.